All right, welcome to lesson 17. We're going to continue this is our second lecture on differentiated learning, and we're going to look at behavioral issues, mental health issues, and gifted and talented students in this particular one. So let's jump right in. Okay, so students with behavioral issues. You will have students with behavioral issues in your class. Some behavioral issues stem from learning disabilities. Some will stem from low cognitive functioning. Others are based more on a personality, on motivation, on sociocultural issues, on peer pressure, on home life. So again, all those things that we've been looking at, those will be potentially some of the reasons why you'll have behavior issues. So I'm not going to really jump into so many behavioral issues. I'm going to introduce you to a couple of ways that schools and individual teachers can deal with behavioral issues, and a couple of systems that you might be hearing about out on your practicums or sort of if you're talking with teacher friends, and I want you to kind of have a sense of what those systems are. So this Positive Behavioral Interventions and Support, or PBIS, is a resource that gives some practical ideas how to work with children with particular behavioral characteristics. Again, whether it stems from a learning disability or low cognitive functioning or really other reasons. So basically we have tier 1, this is a tier 1, 2, 3 support system. So tier 1 is basically kind of a school-wide or a universal system for everybody in the school. So this is where you teach all the kids in the school, kids with behavioral issues or not behavioral issues. You teach them basic behavior expectations. So things like being respectful, being kind, or whatever the school believes is the best way to interact in the school. The whole school talks the same language and has the same expectations for behavior, which sometimes is really good for students, because even in elementary, if they're going from their homeroom teacher to their phys ed teacher to a music teacher to maybe an art teacher, and everybody has different expectations and everybody has different language, sometimes they get confused, or they're very smart and they start to know who they can play off who and what they can get away with in this class, but they can't in this class. So again, tier 1 kind of gives all the teachers a chance to talk about behavior and then use the same language. Tier 2 provides an extra layer of support for kids who continue to struggle with behavior. So they're still struggling with following social guidelines and classroom expectations. Then that's tier 2 is an added support. And then tier 3 is the most intensive level. It's for kids who just need that individualized support and services because of their behavior issues. So those might be some of your ODD students who they just need real individualized support in order for them to function in the classroom. Okay, so here's the website, but I'm going to go to the next slide, because what I want you to do, and I've allotted a little bit of a time for you to do this in this lecture. So I want you to go to this website. It's I really like it because it's really kind of practical. Like, it talks about what do you do if the child is defiant or the child refuses to follow directions. It kind of gives a nice little list of actual practical things that you can try. So what I want you to do is I want you to pick at least 2 of the behavioral issues on this website, and then go through, and I want you to share what the student may do. That's what it says, student may do. And then what are some possible interventions for you? And then you're going to share those 2 in Collaborate time. So stop me right now and go and have a little poke around on this particular website, because I think it has some real practical components to it. Okay, hope you enjoyed that PBIS little romp through that website. I'm going to introduce you to 2 other sort of systems. RTI, or Response to Intervention Approach. We use this in Medicine Hat Public specifically, and I wanted you to kind of know about this. It's built on the premise that most students will thrive with proper supports at school. So again, it's that, okay, we need to support all the students. It's flexible so that if a child is having, if there's like cognitive issues, we will deal with that differently than a child who is not motivated. So that's the flexible, and it ascertains which students need the most support. Okay, so again, what I'd like you to do is just stop me for a sec, go to this site, and go to the video. You have to scroll down a little bit to get to the video, and it's about a 4-minute video, and it's actually really a nice comprehensive view of RTI. Again, you probably will hear about RTI out in your practicum. Okay, so stop me, go to this. Okay, so that's RTI. Now you'll also probably hear in Medicine Hat CRM, which is a collaborative response model. And this collaborative response model is an Alberta-born framework. So that's kind of cool, that values and accelerates purposeful collaboration, action-focused responses, data-informed discussions, and timely intervention to ensure, again, all students can experience success. Educators are empowered through collaborative processes that enhance professional capacity and honor the collective wisdom of those working with students. So that's from the little small print website there. That's where I got that information from. Just a little aside, one of the main authors for the CRM was my professor at the University of Alberta when I did my bachelor's a long time ago, and so that's kind of cool. As well as Mark Davidson, who is the superintendent of Medicine Hat Public, was also a big part of this particular model. So if you keep scrolling down, you'll actually see Mark listed there, which is again kind of cool that it's that this is a homegrown model. So again, have a little bit of a look at the video. Again, you have to scroll down to the video, and if you want more information, go to the overall information. You don't have to do that, but do watch the video, because again, when you're out in your practicum, either this year or next year or the year after that, you will hear collaborative response model, and I want you to know that it's a model to, of course, help all the students with behavior, but especially help those ones who are in like that tier 2 and tier 3. Okay. So let's talk about, and again, these are big issues. We will encounter as teachers students with mental health issues. And even so, you go, oh, I'm going to be teaching, I want to teach kindergarten or grade 1. You will still have students that are coming to you with maybe the beginnings of mental health issues, or some attributes of mental health issues. If you're teaching junior high or high school, you will definitely start to see some of these issues in your students. Now, these kids who are coming to school with mental health issues, they're exhausted they're just trying to be normal. And what's happening is there's this, in some situations and some mental health issues, there's this voice inside their head that is just constantly telling them that they're stupid, that they're not worthy, that why are they even here? And so it's much bigger than, the angel and the devil or our inside voice. It is this constant. It's this constant for them, and so they are just exhausted usually, just from trying to battle that voice and do math and have friends and do all those sort of normal children type activities, teenage type activities, and then also battle this. I oftentimes I think for those who do not suffer with mental health issues, we're just like, well, just get over it, pull yourself up by your bootstraps and move on. It's way bigger than that. If they could, they would, but they actually cannot. They actually can't get over that. And I think that that's something that again, you need to know in order to differentiate. You need to know. Unfortunately, so the scope of this course, we cannot discuss mental health, but the kids who look and act normal sometimes will have lots of issues going on inside. So they may have some form of depression. And again, this will be on a scale, on a scope. This is not just, oh, I'm so depressed. This is debilitating. and when it potentially might lead to self-harm, suicidal tendencies, those kind of things. Same with anxiety. It's not just, oh, I'm really anxious about this test. It is, again, consuming anxiety and debilitating so that the child actually cannot stay at school because they are so anxious. So again, be conscious of that. Borderline personality is the lows are super low, like, sort of normal, like we sort of just, probably cruise through life like this. Whereas a borderline will be, the lows will be way down and the highs will be way up. And so life is just these extremes all the time. And again, it's just exhausting. Again, paranoia, schizophrenia will probably be beyond what you can deal with. But again, I think you need to be aware that you might have such kids in your class that have these mental health issues and that they are battling. They are battling. And I think you need to dig a bit, as they usually do not display outward signs. They look like every other kid in your class, but you have to dig a little bit in order to get there. Okay. Again, unfortunately, we don't have the scope. This could be a whole course in and of itself. But I would encourage you, if you're interested, Alberta Family Wellness runs a brain course, which is a little bit more suited for social workers. But if you're interested in knowing what's going on in the brain around wellness, it's a super interesting course. And I would really recommend the UBC Mental Health online course. I put the modules that this course runs through. So stigma and mental illness, human brain development, understanding mental health, mental illness and related issues in young people. What is treatment? Seeking help and providing support, caring for students and ourselves. It is you can get a little certificate from it, and it looks good on your CV. So if you have I think it takes 8 to 10 hours. So maybe even in the spring, if you're doing a boring spring job, you could do this. So keep this on your radar. Okay, I have this slide here because I think it's important that you know that programs and schools are being amazing at differentiating. When you look at Herald School vision statement is, Herald School recognizes that education requires a commitment of school, home, and community, strengthened through effective communication and collaboration. We are a safe and caring environment where achievements are applauded, successes are recognized, and everyone is respected. Opportunities are provided for students to develop skills for lifelong learning, helping them to become the best they can be. At Herald School, all the pieces fit. So I think Herald, so you've got Elm Street, you've got St. Louis, you've got those schools along with Herald that really, really honor the diversity, and they walk the differentiation talk. They are pretty amazing. I also put on here, this was a group, You Singers in Calgary. It was a group that I conducted with before moving here to Medicine Hat. And it was interesting because the visionaries said, we're not a complete program until we provide a place for everyone to be involved. And so they created the STAR program, which is an interactive experience that allows youth with cognitive delays to be part of it, where there was no place for those children in the program before this. So again, I think we have the support from schools and from outside extracurricular programs to be differentiating and to be honoring that these students come to us, and that they come to us with all different packages. Okay, let's continue on looking at gifted and talented students. We will have some gifted and talented students in our class. These are outstanding abilities in any one of the following. So general intellectual ability, specific academic aptitude, creative or productive thinking, leadership ability, or visual and performing arts. It's those, sometimes you'll have a child who's 7 and is like not just a good piano player, but an amazing piano player, right? And so they would be probably in that gifted category. I think oftentimes our gifted and talented kids are bored in our class because what we're asking them to do is just way below their actual ability. And sometimes they might become behavioral issues just because they're super bored. So we need to, again, be cognizant. Usually you have about 3 to 5% of children in your class will be gifted. So 3 to 5% in your class. And usually if you're talking IQ tests, moderately gifted is like 130 to 144, highly gifted is 145 to 159, and 160 plus is extraordinarily gifted. So if you want some numbers to think about for gifted, normally we sort of are the normal IQ is as around that like 105 to like 115. That's sort of where normal people hang out. Okay, so let's look at giftedness and talented as separate. Giftedness is the possession and use of untrained and spontaneously expressed natural abilities. So this is where they're gifted with, they just have it, it's nature. So they have it and it's untrained. Talent is the systematic development of natural gifts to a level of mastery. So what we want to do is we want to take our gifted students who come with amazing natural ability and we want them to become talented, because that is where they are actually going, okay, I can actually systematically develop my natural gifts to a really amazing level. So the young man here that you see, his name is Pragnandaha, and he is 12 years and 10 months old, and he is the Grandmaster chess. The Grandmaster in chess. Not in kids chess, in chess. So he, at 12 years and 10 months, is the Grandmaster of everybody. Adults, kids, male, female, everybody. So you think about, wow, he would be in grade 6. So if you got this kid in your grade 6 math class and you're doing, two-digit multiplication by one digit, he is super bored. Super bored. So again, we need to be cognizant of what is going on with our gifted and talented students. Okay. I give you this resource and again, this can be more for your assignment 2 to have a look at. So the Alberta Education Resource for Gifted and Talented Students, have a look at this gives you some really specific ways to be dealing with gifted and talented students in order to support those particular students in your class. So again, that should be part of your assignment 2. Hint, hint. Okay. So in the Collaborate, what I want you to do is I want you to think about sharing an experience you had with a child or a friend who was gifted or talented and what differentiation occurred for this child in the classroom or at school. So be ready to discuss that in Collaborate. Okay, here we go. Special education controversies. There are some controversies in special education around labeling and placement. So again, in Collaborate, we're going to discuss issues around both of these. What I want you to do is I want you to go to the website and just look at, there's pictures, you just click on them and it gives you sort of pros and cons of labeling. So again, I want you to be able to discuss those advantages and disadvantages in Collaborate. So maybe take a few notes on that. And then placement. I'm just going to kind of go through placement. 30, 40 years ago, students with any kind of cognitive delay or severe behavioral issue, they were placed in a separate classroom or a whole separate school. So you'd have like the resource room, and it would often be at the end of the school, and there was definitely a stigma about that. You'd also have a whole school where you would have low cognition and behavioral issues, all those kids together at a school. Now there's definitely some pros to that in that they got really one-on-one or one-on-two teacher time. They had lots of actual physical supports. The school was made for them, but they were never integrated into the classroom. About 20 years ago, there was full integration into the classroom. No more special rooms, no more special schools. All those kids with cognitive abilities, behavioral issues were in the regular classroom. And uh, again, there's definitely pros and cons to having those kids in the classroom. Lots of times, teachers may feel overwhelmed because they maybe don't know as much about the particular syndrome or the disorder as maybe a specialized teacher. But the students in the classroom, they found, become really they accommodate and they become very accepting of all children on any level, low cognitive level, high cognitive level, behavioral issues. And so there's definitely some pros and cons. I'm going to read you a little bit from it's a Princeton publication, and it's called The Effects of Inclusion on Students Without Disabilities. Parents and teachers often have expressed concerns about the likely impact on students without disabilities when children with special needs are moved to the general classroom. Although the body of literature examining this issue is small, in general, these studies have indicated that students without disabilities do not suffer from being in classes also serving students with mild disabilities or severe mental disorders. Non-disabled elementary students have shown no difference on standardized scores, whether they were assigned to typical classes or to an integrated classroom model. Okay. Research on the integration of students with severe mental disabilities has emphasized the social and emotional benefits to non-disabled children and teachers, showing increased awareness of the needs of persons with disabilities, increased levels of social development in non-disabled children, and increased willingness to work with students with disability. So is this easy? No. It's not easy, but the benefits, there are definitely benefits and there are definitely challenges. So again, I want you to think about your own situation, maybe as a student in a classroom where there was a child with low cognition, or maybe there's a child with behavioral issues in your class, and think about the pros and cons of having that child in a regular classroom. Okay, so be ready to jump into that. Finally, you probably heard about IPPs, or individualized program planning. Basically, an IPP is just that. It's an individualized plan for a particular student who needs a bit more support, or they are not going to be able to reach grade level outcomes usually it's because of cognition. And so we have to adapt a plan. So IPP specifies students' educational goals, services students will receive, methods used to deliver services, and placement in which services will be provided. You may also hear the terms IEP, which is Individualized Education Program. You may hear ISP, Individual Student Profile. The terms keep changing over the years. We in education like to change up the terms, but basically, it's the same concept, an individualized program. Okay, so this is how we go through in order to get an IPP for a child. So we basically identify, here I'm just getting my little pencil, we identify that there's some kind of difficulty with either cognition or behavior. Then there's a diagnosis. Then there's a referral, usually to maybe a school psychologist, or maybe to a speech therapist, somebody with a specialized knowledge. Then there's the assessment phase, and then there's the intervention where they actually write the IPP, and then we make it actually happen in class. And then there's the evaluation of the student progress. Hopefully, once you've created the IPP and actually implemented it, the student will progress at their rate. So that's sort of I think it's important, again, for you to have a bit of a sense of what that is. Okay, the Alberta Education IPP overview. Again, I would have a little peek at this, especially consider this for your assignment 2. So this is IPP overview, and specifically look at pages 21 to 41, which is actually an IPP exemplar and the template. So you can kind of get a sense of what is an IPP. It's not as daunting as you think it is. It's time consuming to create as a teacher, but you never do that in isolation. You always do that with other teachers, with the specialists, with the psychologists, with the speech pathologists. You know, it's not a solitary creation. So again, I would definitely have a little peek at that. It should. Oh, okay. And finally, I want you to think about this final question. From your school years, can you recall a student who frequently exhibited attributes of a child with special needs or diverse ability issues? So really any of the children that we've talked about so far. How did the student's actions affect the overall classroom environment? How did you and your classmates respond to this student? What were your frustrations and what were the positives of inclusion? So this is kind of a wrap-up question, but again, I want to have this discussion in our class time. Okay. As a bit of a wrap up of this particular lecture on behavioral, mental, gifted, and talented, I want to read you this poem. And I think it kind of goes with this. Once you learn to appreciate the small victories, there is no need for a finish line. So again, when we get to know those students, when we differentiate for their particular needs and they achieve, that's what we do. That's why we do it, right? That's why we do it as teachers. Okay, so here's the poem. This poem is written from a parent point of view, and it's written from a parent point of view who has a child with a disability. So, Welcome to Holland by Emily Pearl Kingsley. I am often asked to describe the experience of raising a child with a disability, to try to help people who have not shared that unique experience to understand it, imagine how it would feel. It's like this. When you're going to have a baby, it's like planning a fabulous vacation trip. You buy a bunch of guidebooks and make your When you're going to have a baby, it's like planning a fabulous vacation trip to Italy. You buy a bunch of guidebooks and make your plans. The Colosseum, the Michelangelo David, the gondolas in Venice. You may learn some handy phrases in Italian. It's all very exciting. After months of eager anticipation, the day finally arrives. You pack your bags and off you go. Several hours later, the plane lands. The stewardess comes on and says, "Welcome to Holland." Holland, you say. What do you mean, Holland? I signed up for Italy. I'm supposed to be in Italy. All my life I've dreamed of going to Italy. But there's been a change in the flight plan. They've landed in Holland, and there you must stay. The important thing is that they haven't taken you to a horrible, disgusting, filthy place full of pestilence, famine, and disease. It's just a different place. So you must go out and buy new guidebooks, and you must learn a whole new language, and you'll meet a whole new group of people you would never have met. It's just a different place. It's slower paced than Italy, less flashy than Italy. But after you've been there for a while and you can catch your breath, you look around and you begin to notice that Holland has windmills and Holland has tulips. Holland even has Rembrandts. But everyone you know is busy coming and going from Italy. And they're all bragging about what a wonderful time they had there. And for the rest of your life, you will say, yes, that's where I was supposed to go. That's what I had planned. And the pain of that will never, ever, ever go away. Because the loss of that dream is a very, very significant loss. But if you spend your life mourning the fact that you didn't get to go to Italy, you may never be free to enjoy the very special, the very lovely things about Holland. I just think that's kind of a cool poem to wrap up this lecture on differentiated learning. Take care.